Started. All right. I think we will get started. I've had a few regrets today. It's been particularly hard for some of the childcare folks to be here because we're covering classrooms. Lori Metcalf won't be able to be here today, but for sure, and Wendy Cunningham. So let's get started with some introductions. Let's see, we also have a new, yes, Alyssa's here too. So I'm actually, what I'll do is I'll introduce myself and then we'll go to Nicole and we'll just do quick our names, what organizations we're at, and then I'll just maybe just call on you so we don't get to that awkward part where we're all speaking at the same time when we try to say who we are, because we do have a new member today. So we'll introduce her first after we introduce some of the folks that help plan this meeting. So I'm Sherry Carlson. I'm the Chief Programs Officer for Let's Grow Kids, and I am co-chair of this committee. And we'll go to Nicole.
Nicole Dubuque. I am the Policy Director for the Child Development Division at the state of Vermont, and I am the other co-chair. Jen?
Hi, I'm Jen Severance. I am a Community and Program Support Specialist with Let's Grow Kids.
Thanks, Jen. Is Leslie here today, Nicole? I don't see her on my screen. Leslie also is a member of the Planning Committee.
She may hop in and out. She is in tests for TOTS stuff.
Oh,
so.
Yes. Yeah, okay. So if she pops on, we'll call on her. Beth?
Morning, Beth Kuzanski, Deputy Director of Building Bright Futures.
Thanks. Dora?
Good morning, everyone. I'm Dora Levinson, Director of Research and Data, Building Bright Futures.
Great, and Dora will be one of the presenters today. So I want to start with Alyssa, who is a new member of our of this ELD committee.
Hello, Alyssa Campbell, and I am the founder of Eden, so we work in emotional development for tiny humans.
Thanks for joining us, Alyssa. Let's go to Linda, January.
Hi, Linda from Otter Creek Child Center in Middlebury. And I guess I got lucky with a sick kid, so I'm home today and not in the classroom.
Keith?
Keith Williams, Director of Children's Integrated Services, part of CDD. Father of a 3-year-old who is a likely exposure, so juggling as well.
Thanks. Shelley Henson?
A COVID update? I don't have COVID, but I know how to test to stay. So if you ever want your nose swabbed, here I am.
Thanks, Shelley.
I'm the Director of Early Education for Champlain Valley School District.
James?
I'm Jim Chmerky, Director of Planning for Southwestern Vermont Healthcare, and I just want to take a second to recognize Beth and Dora and Morgan, who on Monday did an absolutely awesome job. That was so impressive. So congratulations on success on Monday.
Thanks. Yes, I thought it was also really well done. And we're going to dig deeper today on some parts of that report. So be a great meeting. Janet?
Hi there, Janet Mclaughlin. I'm the Executive Director of the Vermont Association for the Education of Young Children, and I have no children home today, just me and my husband and my dog. So very excited.
Oh, this is the second meeting we've celebrated that with someone not having kids home. Michelle?
Good morning, Michelle Trea, the Parent-Child Center of Northwestern Counseling and Support Services. I'm the Child and Adult Care Food Program Coordinator for 48 registered homes in 3 counties in Northwestern Vermont.
Great. Oh, and Leslie has joined us. Leslie, do you want to introduce yourself?
Yes, sorry, I was still late. I'm Leslie Bergeron, and I am with CDD.
Thanks. Amy?
Hi, everybody. Amy Murphy, Inclusion Coordinator for the Agency of Education Early Education Team.
Diane?
Good morning. I'm Diane Nichols Fleming, the Early Childhood Program Coordinator for North Country Supervisory Union. And we're loaded with COVID up here, but I think that's just the name of the game.
Becky?
Good morning, Becky Millard. I'm the Director of Northern Lights at CCV, which is the hub of the professional development system for the early education and after-school workforce.
So then we'll go to Cynthia and then Matt, okay. Yep, Cynthia.
Good morning, everyone. Cynthia Green. I work with Shelburne Farms and Vermont Feed on Farm to Early Childhood.
And Matt?
Good morning, everyone. Matt Levin, Executive Director of Vermont Early Childhood Advocacy Alliance, he and pronouns. I'm experiencing a different aspect of the COVID reality. The only reason I can be here today is because the State House is virtual, but that doesn't mean I can actually pay attention to anything well, since I have several streams running on my computer. So I'm trying to honor this conversation by being here, but I can't really be, I don't know how to do this, people. I'm with you, I want to be here, and the fact that I'm sort of here expresses my desire to be with you in this conversation, even if I'm disrespecting you by not really being here for this conversation. Yes. So apologies, I'll do my best as appropriations does their stuff to try to pop in and out. So I'll just be offline mostly, but I'm trying to engage. So thank you for all of your work.
Thanks,
I think we all experienced that, Matt, so no need to apologize. We've all had kids home. My kid now talks to the TV when he sees the Zoom streaming of the House and the Senate, so that's fun. We're all there.
That's great. Oh, good, Sonia, just in time, Sonia. We're just introducing ourselves and where we're from, and we had Alyssa Campbell is a new member of this committee, so we were doing that. So your turn.
Great, thank you. Welcome, Alyssa. My name is Sonia Raymond, and I'm the owner of Apple Tree Learning Centers in Stowe.
Awesome. Thank you for being here. I know it's a tough time for those that work directly in the field to have the opportunity to be here with all the other stuff going on, and for those at Child Development Division who just launched the huge program and not long ago, the Arpa program and all of those things. So thank you, everyone. Everyone has a lot of stuff going on, so we appreciate you all being here. I'm gonna make sure I got everyone. Did I miss anyone in introductions? I think we got everyone. And I'm just gonna do a little agenda review. So one of the things I wanted to start with was just a little summary of some action steps from last month's meeting. We had the UVM team back to talk about the Promoting Inclusion and Exploring Supports for Vermont's Young Children report. And one of the items that came up in that discussion was a desire to, as we know, there was a committee formed for K through 12 around what does that look like? The act, I'm forgetting the act number. I thought I wrote it down. I did think I wrote it down. The act that was related to suspension. What is it?
Act 35.
Act 35.
Yeah. The K through 12.
Right, was focused on K through 12, and they had an advisory committee that was looking at what that looks like. And one of the action items that came out of this group was that a consideration for another advisory committee that really looks at how that's implemented for the younger age groups. And I can just update you on the folks that are working on that. The update was they wanted to first have that report final, and then thought that the next step would be then to request an advisory committee that is more looking at the younger ages. So that is an action item that is in process, and that's where it is right now, waiting for that initial report to come before organizing to request further action that focuses on younger children. So that's the update on that action item. And as time goes on, we will continue to let you know where that stands. There were other action items that came out of that meeting that are more longer term, or maybe a future legislative session, but that was something that the committee and the advocates felt was something that could be acted on in 2022 in terms of forming an advisory committee that can look at how that is implemented in the younger age groups. So that's a summary from last month's meeting. This month, we are going to feature primarily the Building Bright Futures team, and they're going to talk to us a little bit about suspension and expulsion data. In some earlier meetings, there has been expressed desire to understand what exists, what are the limitations, sort of where all of that is at. So that's what we're going to start with. And then we're going to dive into more deeply the State of Vermont's Children's Report. And there's two areas we're going to focus on. We're going to focus on the spotlight on workforce and the section on early childhood development and education. And Beth and Dora are going to lead us through both of those segments. And then the Child Development Division is going to provide us with some updates as our final piece of the agenda. As you remember, last month, Nicole had I believe it was a COVID emergency that she had to leave before she had an opportunity to share what she had to share with you. And so we're going to follow up on that today and hope she doesn't get any emergency calls during this meeting.
I sent them in writing just in case. I feel like that'll make things not happen.
Yes. So thank you, everyone. And I will turn it over to Beth and Dora to get us started.
Thanks so much, Sherry. This is not my area of expertise, and I thought that the task force was supposed to include pre-K, and Amy, I'm looking at you.
That's my understanding as well, that it's pre-K through 12. Okay. Because I know Kate Rogers is sitting on that. She is. She's not an official member, but they have allowed her and Tom Ferris through Vermont MTSS to participate in those meetings.
Okay, I just wanted to check. It actually leads right into part of what we're talking about with suspension and expulsion data and this potential data brief that we are pulling together in relationship to that task force and the recommendations. And I just wanted to make sure that I was understanding that. And that's a great framing for sort of this overview and discussion, that we are bringing this to all of you as the experts, because we want to make sure that this data brief is actually helpful for what we are for the field and is capturing the information that we have and the information that we need. Cynthia, I'm seeing you have your hand up.
Yeah, thanks, Dora. Just a point of clarification, if I could. Even though the task force includes pre-K, is that school-based pre-K or is that universal mixed delivery pre-K in that task force?
Sorry, I had to take my camera off because my internet's acting wonky, but this is Amy. It's my understanding that it's universal pre-K. So Kate, when she is providing input, across, all areas, mixed delivery, public and private pre-K programs.
Thanks. And that's why my camera is off too. Sorry, guys.
Welcome to Vermont.
So I'll just follow up on that. It is my understanding that's partly why there's a desire to look at the report before taking the next action. But I think the other piece was that members of this committee, as well as I believe the UVM team, had looked at who was on that committee, and it did not seem to have wide representation from the 0 to 5 population. So I think that's part of the interest in keeping an eye on that as this committee, and the reasoning for waiting to see what was included in the report before making the next request.
Agree. Totally agree with you, Sherry.
Absolutely. And, I think that when we're looking at this, there seems to be some consensus that that if there's a draft report that comes out that goes to the early childhood field, the 0 to 5, that there there might be that recommendation to have a further task force looking at this earlier age group, because it has been so focused on K to 12, and especially as we're thinking about Act 35 and its implications for both school-based and private pre-qualified programs, and the mismatch there in implementation or expected implementation. So stepping back a little bit, and thank you for helping me navigate all of this again. We have been hearing from everyone, from the PIES report, but and also from special accommodation grant challenges, that there is this real need to put a highlight on suspension and expulsion, and that it seems like there is sort of this, it's coming from multiple places, that there really needs to be this focus on common definitions, really thinking about what is best practice when approaching behavioral challenges, and what does training look like for that. In terms of sort of what we have been able to find for data, especially from the Agency of Education, is really, it's really limited for the zero. It does not exist for the 0 to 5 age group, and because it is officially less than 10. So because we're keeping, because of privacy, that information is suppressed. And there's a mismatch between having less than 10 suspension and expulsions recorded versus what we're hearing from the field, what we're hearing from sort of that qualitative call line. And again, sort of this mismatch between definitions. And so when we're talking about a soft expulsion, a soft suspension, when we're talking about which hours out of the classroom, this type of thing, that there really is a lack of clarity, as well as, throughout Vermont's early childhood system, there's a lack of data, but there is just this real confusion, just like we were confused about we weren't all on the same page about what this task force was including, and finding that information is so important, and all being on the same page. There are so many people who have we all have the same vision of supporting children and families and being able to support each and every child, right? And how are we all approaching this in a way that is that's aligned? Shelley?
Three of those expulsions are from us. So it is so hard to get it into the data system. And not every district has a dedicated administrator, so principals don't know what to do with the data. So if it were to be reported correctly, which it's not, I can tell you that, and get all the way to the school that it goes onto their sheets for the state to know, it's very complicated to explain to the local school that yes, this goes on your form, even though they don't attend your school, and that they belong on our forms and they are part of it. So I wonder, there's like on top of providers and partners not understanding the definition of suspension and expulsion, even the school districts are struggling with that. Where does that data go? It doesn't get, none of that gets reported until the end of the year. So then by that point, it's, you know, months ago and maybe forgotten by the partner or forgotten by, there's no dedicated leader to early ed in a lot of school districts. So I think it's, I don't know the answer, but I do think it's really hard to tease out the information.
And thank you for that context. I think that there's a broader challenge with that connection and what the mixed delivery system looks like, where as we're talking about data, as we're talking about an understanding on, for parents, for schools, for administrators, what this real partnership is looking like. But Shelley, we might reach out to you a little bit about what that process has looked like, and where it's where there might be opportunities. And Amy, I know that you have a lot of experience around this, so go ahead.
Yeah, really just playing off of what you and Shelley have both said. I mean, we've certainly seen that Act 35, we already had an inequity, between, within our early childhood system, and Act 35 has created an even larger gap between, public and private. And like you were saying, those significant differences being the definitions of suspension, expulsion, and then adding in soft suspension, soft expulsion, having that understanding of what those are. The implementation of those high quality evidence-based practices, like you were saying, for proactive and preventative measures. And then that reporting, the difference in reporting up until this year, school districts were reporting once a year. And again, like Shelley was saying, that's if they were receiving, the information. We are lucky in the sense that for universal pre-K, the AOE and CDD work together and oversee programs, public and private programs together. So there's childcare licensing rules and regulations that programs have to abide by. And they, so there is something there for suspension, expulsion. But it's, having that real-time data is just so imperative. So, I'll be the first to say having that clarifying guidance coming from the AOE would certainly be helpful. That's something that the early education team has really been pushing, to try to cover those three areas and to get that real-time data, having the public and private programs send us their incident reports, so we can address and provide support, not just, saying, oh, you've what have you, not to have a gotcha moment, but to really try to provide that technical support and training, to better the system. So.
Absolutely. I think that the real-time reporting, I think, as we're thinking of, there's a delay, right, in how data are reported. So I think this year might look very different because of this real-time reporting and the follow-up by the early education team. I think another big part of this this brief is thinking about sort of the prevention and these best practices. And again, the common definitions when we're using, as all of these systems are working together, again, trying to best support each and every child, there is often delays in how these systems work together. So again, my understanding is that if there is a request for evaluation for student support services, that it does take some time or a special accommodation grant. It does take some time. And Sherry, go ahead and jump in if I'm just off base.
No, Dora, I just wanted to clarify. And I did run up to get some water for a quick second, so I may have missed this. So I just wanted to clarify. So what you're talking about is a brief that Building Bright Futures is working on, right? And because right now the data is less than 10, so it doesn't maintain confidentiality if it was to be put out there in the world because of the low number it represents at this point. So I just wanted to clarify that that's what you're planning on. And so my question then is the data brief going to provide just a summary of the challenges, like the barriers and challenges to the data? Will it include recommendations? So I'm just curious about like sort of the format of what that brief would look like.
Absolutely. Apologies for jumping right in, and thank you for that bigger picture request. And I think that as we would love to be able to just show a picture of what's available, but because there is such limited information, we will be sharing, the under 5 and a little bit about the 6 to 8. We do have a little bit of information about 6 to 8, but there will be a lot of sort of the data limitations, but also the information limitations as we're talking about common definitions, as we're talking about, I think especially about those common definitions, and that there are ideally recommendations that would be coming out and included, and are those coming from the PIES report? I watched the recording from December, and there was this potential for recommendations, and the action step that you were talking about with following up on the task force recommendations. So how are we aligning, not just highlighting the need for these, to address these data gaps, and that that this is a challenge that the early childhood field is experiencing, but also what are our aligned recommendations? So again, thinking about where are the places from all of you either as a committee, as your individual organizations, agencies, school districts, pulling together, and then how are these related? How are we supporting how are we elevating the need and highlighting that in order to best support all of you? Does that make sense? And so I guess I'm wondering if Beth, do you want to jump in a little bit? Thinking about a discussion. What are we missing? What are the current opportunities? Where how is, if we're putting this out in mid-February, is there an opportunity for aligning recommendations from this committee? So Beth, I wonder if you can.
Yeah, I can certainly facilitate that part.
Awesome.
It's been great as people jump in. So we'll give you a minute to process, but essentially the goal of the data brief is to be able to elevate exactly what we're talking about, right? What data exists, what doesn't, what are the limitations, what else should we be considering? So I would ask you as content experts, what else should we be considering? Yeah, Diane.
So one of the things that we always keep coming back to is not just the time, but the ability of our staff and our teachers to understand how to best work with children, and especially with behaviors, and the understanding that it's up to us to create that environment. So I think data around what professional development opportunities are out there and how accessible are they to providers, and what are the areas and what is the coaching that's available, because again and again, we know that coaching is what makes the difference. And until we kind of change that foundational piece, the data is going to get skewed. So in order for me to understand how we're missing the mark on that, I need to know what's available and how able are they to access.
Thanks, Diane. Is there specific professional development that you are thinking of when you say PD?
Well, I mean, we've been doing pyramid model and doing a lot of modeling with, coaching with that. We all know about that trauma is out there as that buzzword, but it's really about looking at, I feel we're kind of stuck right now, and we really know a lot about that trauma, or we feel like we know a lot about it, but actualizing it and making a difference, that to me is one of our big hurdles.
Thank you. Appreciate that. Matt and then Cynthia.
Thanks. Not an expert, but a user of this information. I would observe that if there was a paragraph at the start of whenever this is, and as part of the introduction, that laid out the key differences between the childcare, early childhood education space and the pre-K through and the classroom, school classroom, K through 12 situation, I think that'd be really helpful. In my learning about this over the last year, I've had to be reminded by many people on this screen, the key differences. It's not like it's a big leap. I just have to be reminded. The teaching element is different. The mixed delivery system makes for differences. The regulatory system is different. The funding system is different. I don't think you need to belabor the point, but I think it'd be really helpful to ground it in the key ways that it's different, so that the information and exploration and discussion starts off on the right foot, and people don't think, oh yeah, these are just, little people behind desks and all those. I don't want to go there because it makes people cringe, but laying it out clearly, I think would remind everyone, help people launch into this with the right mindset that would help people get the information that you're trying to present in a way that would be most effective.
Absolutely. I think that you're probably the expert in working with people who are providing that context that not everybody has. That's helpful.
Thank you. Cynthia?
Thanks, Beth. I'm just thinking, I'm not sure that this is necessarily for the data report, but I am thinking when it comes to sort of using the report and thinking about recommendations, how the ability or the inability to cross district lines will impact our providers on the ground. I see Linda shaking her head. When it comes to these definitions and our early childhood private providers working with multiple school districts and trying to get definitions and expulsion data appropriately to the appropriate district at the appropriate time. I just wonder, how is there something that this group could tease out with information from the field that would help improve the data? Not only that, but then any recommendations to address that, because I still think when we're talking about the social emotional health of children and that professional development that Diane was thinking about, how is that shared with our early childhood providers across districts to create that sort of seamless approach, if you will? I think there's a nugget there. I just don't know what it is, but I'm curious about it.
Thanks, Cynthia. I see a couple other hands, Shelley and Sonia. I don't know whose hand was up first, so go ahead.
I can only see a few people, so I don't know either. I think this kind of goes in that thread of, I don't know why I had an aha about it, but in a different meeting yesterday, we were talking about this topic of the workforce development. So, and how it's connected to suspension and expulsion. So if the Act 166 is requiring a 10-hour week teacher and students are attending a program 40 hours a week, and if you're in a program 40 hours a week, you need an expert in the pyramid model more hours than 10 hours. So you have it 1/4 of your time is an expert teacher. Not that other teachers and staff aren't experts, but if that is your one teacher who's driving the curriculum and driving a social emotional curriculum, that doesn't seem like it. It's not logical to me that that is the expectation that a center that 10 hours a week would make those other 30 hours the same as the 10 hours of the teachers there. And I also, backing up with Diana, the pyramid model for PD would be a recommendation to continue pressing that forward, maybe through the Best Institute would be a way to do that. So anyway, those are my thoughts.
Shelley, go ahead, Sonia.
Yeah, I do want to echo Diane's suggestion around PD. I know we've talked about it before, but absolutely the access for private programs to PD, such as the pyramid model, that includes coaching, is very limited, if even accessible, honestly. So yes, you can get the training, and that's been accessible, but honestly, that training without the coaching is a very different thing. So I definitely would recommend PD like that. But then you get beyond that. And I said this the last meeting, right? You can have all the training, you can be the best teacher in the world, and you can have the greatest environment. And we've got some tough kids out there. They're dealing with a lot of stuff. And we've got lots of kids with lots of needs and some pretty intense needs. And they require more than one person is going to be giving, any one teacher is going to be giving them in a room, where they have 15 kids, so to speak, or 20 kids, right, in a preschool, and only maybe one other teacher with them. So the resources in private programs is very different. So they are really, without access to, and the SAG grants have been limited in the past. And, this year they are better exposed, a better marketed, better, everything. Obviously we're working hard on that. But there is absolutely an element of not having the resources necessary for folks. And I think, unfortunately, some of that is leading to these expulsion, so you get to a point where if a child is violent and you do not have the resources to help manage that, that's where you end up with these expulsions and, those kinds of things. So I would definitely say that, I don't know what to say about the data gathering. That's interesting. I mean, yes, we deal with like 5 different districts. And while that's a challenge in so many ways, I don't think this is one of them, interestingly, for us in terms of reporting that data. It's just a matter of doing it. And I do wonder about, somebody made the comment of feeling like it might be a hand slap, right? Like if you send in the data, and I do have a concern about that, because I've actually heard people say that from to me before, and from programs. And so I don't know how we get around that exactly, other than perhaps some more education about it or presenting it in a different way. But I do worry about that as well, because I do think it's important that we have good data, right? It's hard to know what to recommend without good data, but those are just a few of my thoughts.
Thank you very much, Sonia. Shelley, and then Amy.
Sorry, I didn't put my hand down. I'm good.
No, just to go off what you were saying, them feeling like their hands being slapped and struggling to, understand why they need to turn in the data. We just had that discussion with the AOE data team. You know, how can we create a space or discussion to show that it's really to inform, and then we can take those numbers and take them to the legislators and say, hey, this is, you know, this is a concern, you know, so we need more support, you know, perhaps funding to, you know, for PD across public and private programs. So really trying to push that point, but I completely agree with you.
Thank you all. Great feedback. I'm curious if there, certainly I think there's pieces as we talk about what is included in the data brief, and you know, it's coming out really strong in terms of the need for kind of accurate reporting to be able to call for more resources. And also I think there's some opportunity for this committee, which is an assembled diverse group of stakeholders, to be able to perhaps come out with some recommendations or, you know, elevate these issues that may be in coordination with the data brief. Dora, I don't know if you wanted to add to that, but.
Yeah, I mean, I think that, thank you all. I think that this is, it's reinforcing, but also very, very clear about, you know, some of the things that a task force around, you know, around this early care 0 to 5, some of these questions that need to be addressed. You know, Amy, the comments about having your hand slapped. No one wants to suspend or expel a child, and if they're and so how are we addressing that? How are we providing more resources? If it's PD, if it's additional like support staff, what are these things? What might these look like? And a task force might be the recommendation. I think this is not the time, and perhaps there are a few of you that I could connect with about what some of, you know, a lot of you have mentioned, you know, the pyramid model or early MTSS. There's training available, but the coaching and the implementation isn't necessarily available. And we've been talking about this. You know, I've been with BBF for sorry, I'm just seeing your comment. 10%. We've been I've been with BBF for 4 years, and we've been talking about what actual coaching looks like for early MTSS, and it is that really critical piece. Like, people jump onto the training module 1, they are so excited, they're like, yes, this resonates. But actual implementation and getting to fidelity, we keep getting stuck there, and I wonder if there are a few of you who we could connect with about what those barriers really are, and if it's financing, if it's workforce. I know that a lot of you are the experts and know so much more than I do. So, not now. I would take another whole meeting.
I agree with Linda. Put something else in the chat that I more than 10% agree with, 100% agree with, and that is around the common definitions are really needed. And is one definition appropriate for 0 through grade 12, or do there need to be different components to that? And when there are common definitions, is it helpful to lay out some scenarios in which that looks like? Because one thing I'm hearing is a lot of confusion around definitions, especially when it comes to what suspension means or soft suspension means. So that I think that number 1 is really critical. I want to echo that programs do feel they're going to get in trouble if they're struggling with a child. They'll lose their UPK funding or something. So there has to be something we do around that. We're talking a lot about training and coaching. And I think what's going to be critical to that is that we look at where we can embed that and not add another layer to the systems delivery that we're already trying to navigate. And then we really need to think about like what that looks like in a mixed delivery system as well. Like right now, UPK is 10 hours. And you know, what I hear from the field is the suspension expulsion, even if you only provide 10 hours, extends during any time that child is there. So how do we work with that in a mixed delivery system where it's fee for service, and you may have a family that is not paying, and it's been several weeks, and you can keep that child 10 hours a week because the school district is paying on their behalf, but you're not able to sustain your program and continue to have a family not paying, or situations where families have created an unsafe situation in a childcare program, threatening situation where people didn't feel safe. There's just some challenges there that we bump up against, that which I go back to that mixed delivery system needing some real focus and clarity around, you know, what this looks like in those settings when it's a fee for service, primarily the bulk of the hours.
Yeah, go ahead, Linda, and then Alyssa.
There might be some bubble guppies in the background, so I apologize. You know, to add to that comment, I think, you know, that idea of common definitions, but also I think the confidence in the presentation from the authorities on this topic, right? Like it has to be presented to the field in a really kind of confident, like this is what it is. I think right now we don't have confidence in the system. And so it feels like we don't know when to report, we don't know what will happen when we report, and that the authorities on this aren't even really clear about all of it. And that is really disheartening. And it's also really frustrating that a law that is supposed to include pre-K, to feel like pre-K in early childhood was a complete afterthought, and that this law is in effect, and here we are struggling and like heads barely above water to try to figure it out, when it's just so frustrating. And I don't know what we can do about that, but it's really frustrating to feel like an afterthought.
I'm curious what exists right now for specifically infant toddler teachers in supporting nervous system dysregulation, like those, and early identification of how to support kiddos who might have some sort of neurodiversities, so that we're seeing then fewer preschool, pre-K and beyond kiddos who don't have a toolbox for nervous system dysregulation and that coping skills toolbox. What are we doing to support the infant toddler folks here outside of training, like, excuse me, an ongoing support like from OT or from not just specifically for kids in early intervention, but across the board for kiddos? When we did our research, one of the things we found was that there were really low expectations for infant toddler and then higher expectations for preschool pre-K without that toolbox kind of being supported in infant toddler. So I'm curious what we have in the state here to support that.
It's a good question. Does someone want to respond to Alyssa's question?
I do have one thing that when you said that, it made me think of through pyramid practices, there's a measure called the tippy toes, and you probably, everybody here is probably familiar with it, or you know, it's crossed some kind of conversation, but it's a measure that looks at the environment to, you know, see the inclusivity, you know, what's going on in the environment. So it's just a measure of what kind of practices are being implemented, again, to fidelity universally. So that could be something that could be looked at. I mean, because, you know, you might have children that then need more targeted intervention, but that, you know, you'll have your universal practices in place then. So that could be beneficial.
Is there something outside of the ASQ right now that
I guess all folks, and I'm really thinking about infant toddler here, that's looking at not just the like if they're doing this skill set, but the how and the in what circumstances they're doing it, so that we can fine tune that early identification and be building those toolboxes early for kids. I guess my fear is that a lot of kids are being missed until they're 3, 4, and then we're seeing more behaviors and bigger behaviors down the road that could be supported earlier.
That's a really good point, Alyssa. And I wonder if it's something that we perhaps bring back for some further discussion as well. I don't know if others have ideas, but it is something that we could consider. Okay, so I see a couple more hands, and then I think this information has been super helpful, so thank you. Any final comments around kind of what to consider around the data brief? And we've certainly kind of crept into other pieces around policy recommendations and need for resources as well.
I know Cynthia had her hand up, so I was gonna still talk about a couple points, but Cynthia, did you want to go first?
Sure, thanks. I was just going to say to Alyssa's question, I know I cannot believe that I can't remember the name of it, but the Maternal Child Health Division has the milestones and wellness toolkits that actually really can support whole child development, but actually also really focus on that infant toddler timeframe. It's meant to be used with families, across caregiver family bridge, if you will, and they've done some really great work trying to kick that out, and I haven't seen it necessarily adopted universally, but I think that working with our Maternal Child Health Division, thinking about that toolkit and the milestones could be a really great first start. It's pretty accessible. So it's just something we could think about more universally for that infant toddler professional development and use across the childcare family spectrum.
Thank you. Amy?
And I was just going to point out, when we were talking about the definitions and, is there a way to kind of align those better, because we do have an early MTSS system, we have our Vermont MTSS, so is there a way to align that? But something that when we're working with Vermont MTSS at the AOE, something that we usually bring up is the Vermont Early Learning Standards, early MTSS, pyramid practices, those all cover birth to age 8. And that's because there is a developmentally appropriate factor that comes into play. Typically 9 and up, what's developmentally appropriate changes. So that is something to consider when we're talking about definitions for that 0 to 8 age group, what is going to be developmentally appropriate. And then, just to clarify, in case there's questions, and anybody can obviously contact us and we can talk more about this as well. But with the programs, there is that concern and that confusion, like you were saying, with the definitions and just the understanding of, really the assurances and looking at the hours versus the non-hours. And we are hoping, we've contacted at the AOE, we've contacted the legal team to say, hey, the field is, crying to get this information out. It's just imperative that we get a clear definition and information out. So they did say that we could start working on that clarifying guidance, but a UPK program, we look at the program as a whole because they've signed assurances to ensure that they're following, federal regulations, child development regulations, ADA, all of those things. So that's why we look at the program as a whole versus, more so the child and the hours. So if that just helps to kind of clarify things.
Thank you, Amy. So I want to thank everyone, really helpful feedback. So we will digest some of this, and I can imagine that some of these topics may be interesting for us to dive into at future meetings as well. I want to check with Dora. Do you need anything else before we shift to State of Vermont's children?
I just want to again say thank you to all of you as the experts. I think what we'll do is bring anything that drafts or outlines to share with this group. And if you want to connect about those limitations to implementation of EMTSS, or any of the any more of this that we can connect in depth, please don't hesitate to reach out to me.
Great. Okay. So our next agenda item is really to dive into some of the data in the State of Vermont's children, which is a new title for a report that BVF puts out annually. And so we were going to give a little bit of snapshot of what the report is. I will put the link in the chat bar. We have some slides that we also shared on Monday, but then the hope is to present the data and then to be able to have a discussion with this group about what your experience is and to understand kind of limitations to that as well. So if we're good to make that switch, we will do that. And Dora, I can do the screen share if you'd like.
That would be awesome. So I don't know how many of you were able to attend the meeting, the briefing on Monday. I apologize if this is repetitive, but maybe we'll go through it and then we can always sort of go back around once and switch around with the slides. I'll go through them quickly. So the State of Vermont's children is actually required through BVF's mandate to share with the legislature at the beginning of each session about the State of Vermont's children. And we've in the report, we include the State Advisory Council Network policy recommendations, which you helped write, and through the VCAP Summit, through this committee. So those are in the report, and we also have this workforce spotlight and then information on the child development and education. There are a bunch of different sections, and we'll just go through a few of this, two of the sections and a couple of indicators within those. And again, these don't tell the full story. There's always more, and how are we? So it doesn't tell the full story, and but it's what we have. It's a great sort of point in time capture, and a lot of it is already out of date. So there's again just all of these caveats, and humble brag, that is my baby on the cover. So he's super cute, and is in childcare right now, which I'm very grateful for. Beth, do you want to go to the next slide? So again, these are the recommendations that were endorsed in November, and in line with what was in the previous year, to respond to Vermont's mental health crisis, to address chronic inequities in Vermont's early childhood system, to elevate families as decision makers, develop a well-resourced early care and education system, and evolve the early childhood data system and infrastructure. infrastructure, many of which we've touched on already today. Can you go to the next slide? So childcare workforce, I know none of this is going to be a surprise. And I think that from preliminary numbers from Let's Grow Kids, it has this decline in the unduplicated individuals working in regulated childcare settings has dropped even lower. Sherry, did you testify this already, or was it Sarah maybe? It's something around.
Sarah did.
Yeah. So it's dropped even further, not surprisingly, but 14% between 2018 and December 2018 and December 2020. When we look at Head Start, there is the gaps there have decreased the number of slots. 27% of slots are unable to be used because of the turnover and vacancies. So again, just doing a super quick pass on these slides, and then we can go back and dig in a little bit more. So let's go to the next slide, which is about the mental health workforce. And again, one of these recommendations is really about the mental health crisis. And we are seeing that in children. We're seeing the national survey data that we have is showing a steady increase even before COVID in the number of children with a mental, emotional, behavioral, or developmental condition. Both, and as we're seeing here, so the previous slide is the individuals working in childcare. This is the number of vacancies, which are increasing, 72% increase in vacancies. And this is actually even further when we look at September data, which is 970 vacancies. In addition to vacancies, there's this 31% turnover rate. So when we think about training, when we think about that gap, when we think about who children and families are working with, when we look at that turnover rate, that is also a really important indicator to consider. So let's just move on to the next one. And that's in designated mental health and specialized services agencies. Again, no surprise, and this is across the nation, 3% left their 3% of Americans left their jobs. We're looking at mid-career professionals, disproportionate representation of women leaving the workforce. And when we look at Vermont specific data, 28,000 fewer people than 2 years ago. And apologies for reading the slides, but I think just as we're going through really quickly, there are Vermont's workforce. So when we talk about labor force, this is people who are working or who are looking for work. So it includes unemployment. While Vermont's workforce from August to August has declined, there are other states in the New England region that are increasing. So it's not necessarily, it's not a regional trend necessarily. It's not, it's Vermont specific, although again, in this larger context of the Great Resignation, and again, seeing that disproportionate impact for women who make up this larger percentage of personal care professions. So let's move on to the next one, which is focused on child development and education. This is scale's a little off here, but what we're seeing here is just breakdown by age, infants, toddlers, and preschoolers. And then the blue is center-based, purple is registered family, and then orange is the licensed family childcare homes. And the other thing, oh my goodness, I just lost my train of thought. But as we're talking a little bit about data, this information, so the preschoolers do not include all universal pre-K. They don't include all universal pre-K students because this information is actually coming from the immunization data, because each program is required to report that information. That's our best source of childcare enrollment, which in and of itself says something. But clearly more children in center-based childcare. Let's move on to the next one, which is universal pre-K enrollment, which was really steadily growing since Act 166 to about 8,666, dropped to this 6,673 in 2020, and now it's 6,675. And there are many factors that could be contributing to this. We don't know the full story, but this is utilization, not demand. We don't know what these various factors are. Across the state, 54% of UPK students are enrolled in these private pre-qualified programs, while 46% are in school-based programs. Huge regional variation with some supervisory union school districts enrolling 2% of universal pre-K students in private programs to others enrolling 98% in private programs. So as we're thinking about that distribution and that mixed delivery system, there's some regional variation. Is there one more slide, Beth? Okay, and here we have third grade reading and math. And so these were collected. So TS Gold was not collected in spring 2020, and we don't have the spring 2021 data available yet. We would have loved to be able to present that. Third grade math and reading was conducted. All of the assessments in the spring were conducted, but because of everything going on last spring in terms of remote and hybrid and in person, as we're talking about what the implementation of these assessments look like, they cannot and should not be compared to previous years. However, there are, again, some striking differences when we're thinking about equitable access and what that might look like. So across income, across race, across homelessness and student support services, all of that is actually pulled together into two categories. One is historically marginalized and one is historically advantaged. And historically marginalized is just any of those who may have been historically, who meet one or more of the characteristics of having been historically underserved in educational systems. And when we look at historically marginalized, only 27% were proficient in math or reading, which is, that means that 73% of historically marginalized students are not proficient in math or reading, compared to 59 and 57% who are in that historically advantaged category. So really significant differences in those categories. So that was a really quick overview, but I just wanted, here we are. I wanted to be able to dig into what you're interested in. I can provide a little bit more context, and hear a little bit more from you.
Thank you. I wonder if there's any, Jana has a question. I can, whether it's related to the slides, I will either pull them down or leave them up. So why don't you go ahead?
They are about the two clarification questions. Is so one for the slide on enrollment. I just want to make sure I was looking at that properly. So I think it shows, right, that, oh, sorry, not UPK, the general, yeah. So for this one, and I think that using the vaccination data or immunization data is a clever workaround there to find that information. And I know you mentioned the scaling being not quite right, but I feel like what this slide says partially is it does speak to the really important role of family childcare, especially for infants and toddlers, right? They're serving a bigger percentage of that market versus preschoolers, right? Because this is the place where, right, that blue bar should probably be taller, but that's right. Like it's just knowing that once you get to older kids, it seems like they're in center-based, and of course, a good portion of that is school-based capacity. So that was one of my observations. I wanted to just make sure if that sounds correct.
Absolutely.
Okay.
Registered family childcare, home childcare.
Mm-hmm. And then I wanted to just check on the data around the number of folks working in the workforce, and that decline. And I wanted to just confirm again, does that data includes people working in after school only settings or summer only settings, right? With school age children, is that right? Or is it just, is it just, folks that are serving programs that are serving children 0 to 5? Do you know?
I believe it is for 0 to 5. I'm going to double check to make sure that's what we're talking about.
Okay. I just want to make sure, yeah. I'm sure whatever the answer is whatever the best available data is, and I just want to make sure I can represent it correctly.
Absolutely. So I will get back to you on that.
Thank you. Any other questions about the data that's been presented or something that surprised you, your observations?
Sonia has a good question in the chat.
Okay, I have not seen that. Sonia said, wondering about capacity of childcare in pre-K now versus 2 years ago. How does this affect the workforce numbers?
Can you say a little bit more about that?
Yeah, I was just meaning I don't know what the numbers of the capacity was, say, pre-COVID. Like, what was the capacity of all of our home licensed, home registered, and center-based programs, and school-based preschools as well? Like, what was the capacity? Meaning, how many children were they able to serve, the number of programs, that kind of thing, then compared to what they are now. And if there are fewer now slots available, so to speak, that to me speaks some to our workforce, right? So if people are not in the workforce, it could be their program is closed. I'm just trying to see like what's the effect of that. I do know there's been a lot of program closures, or at least capacity decreasing in programs. I just don't know how much. I didn't know what the data showed, or if you might know.
I think this is a place where a lot of the why is not known. So that's definitely, you know, when we're thinking about capacity, when we're thinking about the impact of COVID and regulations and the workforce and parent comfort with sending their child to a program, that there are a lot of variables that may be impacting the utilization, right? The number of children who are enrolled. And
I figured I understand there's a lot of variables for the number of children enrolled.
Yep.
I just wondered like the actual capacity, like what's the possibility of enrollment, right? Entirely. Like, is that decreased, increase? Like, that's what I was just wondering. You may not know that right now, or that we might have accurate data on that. I don't know.
So, you know, it's interesting, and you know, I wonder if there's somebody else who you know, Sherry or Janet, or someone else who might be able to jump in. My understanding is that there is information collected, that we have licensed capacity, that we have desired capacity, and then we have enrollment, and that those three numbers are very different. And even when we're looking at desired capacity, you know, with COVID restrictions and staffing, that even that desired capacity may be above what's actually possible. And, you know, is capacity, like, is a slot now the same as it was 2 years ago in terms of like availability of total hours and before care and after care? I don't think that we have that information, but I'm gonna pause and wait for our experts to jump in.
So I can say that we have been looking at Let's Grow Kids at capacity, licensed capacity data, because that's what we have available over the, you know, we look actually at it quarterly in regards to our capacity building program that we collaborate with the Child Development Division with. And surprisingly, that capacity has been somewhat stagnant. Like there's been some decreasing, but as programs are closing, other programs are opening. What we've seen a little bit is more of a trend of more center-based programs that are opening. So obviously the slots are more in terms of what's available. But that's all we have for data is our license capacity. And we do know anecdotally that desired capacity is likely even less than it was in January 2020, because license capacity has always been the very most you could serve. A lot of programs dial that back for reasons around quality and group size, that is promotes better environments. And then when you have COVID and a lack of staff and some of the other challenges there, that desired capacity in a lot of places has even reduced a little bit there. So, and I just also, Sonia, I saw your question. So, when I was hearing about the decrease, and we don't have additional data for this, but I made some assumptions last year when I heard about universal pre-K enrollment dipping, that it was probably entirely families not choosing to send their children. It was health, because of COVID, because of sometimes it was just unpredictable when it would be available, et cetera. But I also have heard anecdotally from school districts that there is less capacity in community-based programs for them to place children.
That's all helpful. Thank you, guys.
Yeah.
Thanks, Sonia. Any other observations or questions? Matt, I see your hand up.
Yeah, just share a success story for BVF. In my bopping back and forth, there was just a debate in House Appropriations about funding for the Vermont Food Bank, and Representative Iacoboni used data from this report to back up his argument as to why, well, it doesn't matter what, I don't want to be partisan or whatever. He used data. The point is he used data from the report to back up his argument. So instant success for BVF, congratulations for that, and an indication of how it can be hard to use this data because there's so much data, but there it is right there, real world impact. And I think it was important in carrying his argument. So good success story.
Thanks, Matt. It's always great to hear how it's being used. Michelle?
Hi, I guess I just want to say, like others have before, great job capturing the data. Working in the world of supporting childcare, obviously I'm very well aware of that, but I also work at a mental health agency. So thank you for including that in this report because the struggles are real. We need so many staff right now, it's not even funny. So thank you for making sure that was in the report so it can be highlighted.
Awesome. Thanks, Michelle.
So again, I'm here if you have any questions. There is more data than we're able to put in and more context than the 2 sentences that are in the report. And so if you have any questions, honestly, like 8 times out of 10, somebody asks for a piece of data and I say it doesn't exist, but we do keep track of those requests, and it does help with that recommendation around developing our early childhood data infrastructure. But do feel free to reach out, and if you have something that should be in there or that we should report on our on the Vermont's Early Childhood Data and Policy Center, or in a report next year, what would be helpful, please let me know. And people have been pointing out some errors, so if you find some errors, please do that as well.
I think it also, there's no lack of things to be talking to your teams about, certainly. However, being able to kind of being able to read and understand data, I think, is an important skill to be able to also understand why quality data reporting is important. So to the extent that there is an opportunity to talk with your team, even to look at just one image and to be able to talk about what you're seeing and how to read it, especially if they've contributed in their reporting to those pieces, I think it can be really interesting. There will be discussions at upcoming regional council meetings using different sections of the report, so you're always welcome to join there as well.
I just wanted to make sure if there's anyone else that had a question or had a request around what sort of, what else do we want to know more about? I heard questions around what is the capacity now, questions around sort of the workforce numbers. Is there any other pieces of information that we might want to dive deeper into in future meetings or to get on Dora's list? Janet has her hand raised.
With all of the workforce development programs that Vermont AUIC is working on and trying to keep moving forward and make sure they're serving the needs of the field, it would be really
great to have more information on the levels of qualifications within the field so that we could understand where, and I don't know, if, potentially length of time in the field. I know that the BFIS data probably wouldn't be perfect about that, but it might give us a little bit of information on how long people have at least been working in the system in Vermont. And again, that might, again, help us be able to make sure that the workforce investments that we're asking the legislature for and that we're beginning to implement are really well targeted.
I believe that CDD is coming out with a new workforce report. Should be coming out with a new workforce report that will have sort of individuals with education verified in BFIS. I don't know that there is, but yes, let's noted.
Cynthia?
Hey, thanks. I was just thinking about Sonia's question a little bit about previous data, and many of us might know about the Center for the Study of Childcare Employment and their work over the last 30 years with Marcy White book. But they have the workforce index. They have trends over time on early childhood. They break it out by state. So that's some data that we could also include or look at if we wanted to look at some historical data about the workforce. And then just an observation as I've been reading the report from VBF, it's really striking to me, you know, the context about the mental health profession and 31% turnover rate, which is extraordinary and, you know, one-time high. But if you look at the historical context of early childhood, that has been our turnover rate for like 30 years. And so I think there's a message to be linked to about we are not kidding about the workforce crisis, and this has been in effect for 30 years, and our field is exhausted. And just like we need to pay attention to all workforce issues, this can't be swept under the rug. And I say this because in some of the other spheres I'm working in around food security, we're getting a little bit of feedback from our legislators that we just put a bunch of money into food, we just put a bunch of money into early care and education, we've checked that box. And so I think that in some of my other teams, thinking about how to work with the legislature this session, how to continue to gracefully message and keep the pressure on without burning out our legislators either, there is some messaging work that we might need to do to say, we really appreciate the investments. We know that you've looked at Arpa and CARES and potentially Build Back Better, and it is still not enough. We have not repaired the system. We haven't created a system, and how do we do this gracefully? So it's just this observation between sort of this call out, you know, and questioning this 31% turnover rate, and yet I think that this is a systemic issue that early care and education has faced for decades.
Thank you for that comparison and for that data source. I will look into that. And it is the consistent workforce turnover that is that coming from there as well?
Matt?
Yeah, just want to reiterate what Cynthia just said. Extremely incisive observation about the legislature right now.
Mm-hmm.
We're having trouble with our messaging because they feel like they've done enough or the problems aren't there. I don't want to belabor the point. She's already said it well. Just want to second that, and we're trying to figure out what to do about it on the advocacy side. Not the key topic of this group, but something that we're working on for sure.
Thanks, Matt. I just want to reiterate, before the pandemic hit in 2020, Let's Grow Kids had done some analysis and estimated that we needed another 2,000 early childhood educators to in the field, so that all those who wish to have access to early childhood education could. And that was before the pandemic. So when you take that number and then look at where we are today, it is an intense need, and it is not like, oh, we already did that, because there's a long history of not investing that we desperately need to fill that gap at this point. A couple things before we transition to hearing from the child. That Nicole is still here. Yes. Do I see Nicole? Yes, there you are, Nicole. Okay, Nicole, I wanted to make sure you were still here. A couple things before we transition. I think perhaps maybe next month our meeting is focused on the work being done around the early childhood system. So we'll be in the role of our advisory role at the February meeting, which is on a Friday. You should all have the invite. It's Friday the 11th. But maybe in March, a topic could be diving in a little more deeply to the workforce information we have, and specifically maybe asking Vermont AYC for some presentation on the workforce programs that they're running. And maybe we also could look a little bit at what we know about capacity in the work that Let's Grow Kids and Child Development Division are doing together. So that's just some ideas around a potential future topic. And I saw Alyssa had her hand up, and then we'll transition to Nicole and her updates.
I apologize, this is my first time here, so maybe you've covered this before, but have we looked outside of Vermont, like other states? We work really closely with New Mexico, for instance, and they have a lot of cool initiatives happening to boost workforce in New Mexico as one state, for example. But are we looking outside of Vermont to see what's happening and how other folks are bringing in teachers initiatives to do that?
Yes, I would say we are. There are a number of, there's Vermont AYC and Let's Grow Kids staff members that are participating in work groups, actually receiving free consultation from the center, CSCCE. So yes, definitely some like really great ideas out there. Very few actually implemented. So we could be first. So I'm going to turn it over to Nicole to give us some updates.
Thank you, Sherry. Okay, I'm going to run through my notes. So if people jump up and have things to say in the chat, just tell me. So the first thing that I wanted to touch on, we have a bit of an update. I was going to give it last month, but now I'll just kind of do it all together, is on expedited variances for ratio and staff credentials. So as we've talked about in this meeting on several of the topics that we touched on, there's considerable barriers to hiring and retaining staff in the field right now. And I appreciate Cynthia brought up that it seems like these barriers have been there for a long time, but they've been really exacerbated by the pandemic. So the CDD explored back in September, October, filing emergency rules to update licensing regulations for ratios and staff credentials. And that would have been for program director, teacher associate, and teacher assistant positions. So it was ultimately decided that the CDD could instead institute an expedited variance process, which is essentially a simplified version of the variance process that already exists, but it was pre-written for providers to basically agree to. And for that reason, we didn't think that we needed to file emergency rules because we had already had an interim solution. So instead, we're going to be proposing a permanent rule regulation revision for ratios. And we will be further evaluating variance data as well as collecting stakeholder feedback to determine if any revisions to staff credential regulations are necessary. So right now we have collected some numbers on that. So the number of programs that have requested an expedited variance, which could include ratios or staff credentials, is 62. We've had 62 programs. 44 of the 62 programs requested the variance for ratios, and 55, so a lot of the programs requested both, but 55 of the programs requested the variance for staff credentials. So we're looking at that. We're in the process of creating a survey to put out to those programs to see how helpful this expedited variance was in hiring, promoting from within, retaining staff. So we're looking at that. And then Crystal, who's our director of licensing, will be developing a plan along with myself and a couple others to collect stakeholder feedback. So that'll look like some large groups being able to talk about this data of the variances, what we thought was helpful for programs, what we didn't think so, and collecting additional feedback. So that's what that's going to look like. I will keep this group updated on what the timeline will look like. And of course, you'll see written communication go out about that as well. Any questions on that, or should I move on to the next point? Not hearing anything or seeing hands.
Sorry.
Oh.
I just put my hand up. Those two topics really scare me because it's like we're trying to fix the workforce problem by allowing us to have more children in a program with less staff. So I understand the business part, like I know the work that we're missing people. Then this is, I'm not shooting the messenger. So it's the staff ratios and the qualifications drive quality. So I can see an emergency variance, but when you say that you're looking towards a rule change, that scares me. A rule change would mean that we're giving up quality because we can't find the workforce that we need. And if it were permanent, you know, I just think of like other ratios in other states like Florida, where they can have so many kids per adult that, I don't know. Anyway, that just made me like, oh, cringe, because Vermont has worked really hard to closely match the NAEYC standards for ratios. And yeah, and I do understand both sides, but just that made me feel like, oh, what are we giving?
Yeah. So I'm happy to send out to the group again what the ratio revision was that we used in the expedited variance. It was essentially, let me see if I have it in front of me. It was a fairly small change, just including a larger range in the age group for 1 to 5 is the big shift. So, which is not like a huge shift. So that was the change, and I can send that out if it would make folks feel better to be able to see what the actual ratio change is, because it's not a big difference. And then as far as, you know, the qualifications, like I said, there's going to be a lot of stakeholder feedback, and I just wanted to give an outline of what we're looking at for process to this group, but we do not have the results of that survey back yet for who already got the expedited variance and who's using it and who is able to hire or promote using that variance. So we don't know what it's going to say. We don't know that it's going to say that it was helpful or not. And we're definitely making sure to leave room in the survey for people to, you know, express that same concern, Shelley, that like, we weren't able to hire or we were able to hire, but we weren't able to retain. And we feel like it's, you know, not helping our quality to. So we will be looking for all of that feedback. I just want to assure you of that.
Thanks, Nicole. Janet, you had your hand up.
Yeah, two things. One, it is interesting because it's like this whole conversation, right, really got at, you know, a couple of the core tensions there, right, of sort of in terms of thinking about the expulsions and, you know, having staff prepared to work with, you know, children and families that, you know, maybe having difficult circumstances or behaviors. And then also having this hiring crisis, and like these are like competing tensions that like we have to work through together. So I'm really excited to be a part of to like help CDD as you guys are looking at this and looking at the, you know, and gathering stakeholder feedback. And obviously I'm happy to, you know, share all of the work that's been done with the Advancing as a Profession initiative, you know, that's engaged over 2,000 educators over, you know, within the state. So a really high percentage of the workforce, not just program directors, but also frontline staff.
which I think is really important to think about when we're thinking about the stakeholder process. So, and I know, Nicole, you said more information to come on timeline, but is there any any more detail you could add to that?
So, we have a lot of competing priorities right now, but the best timeline I can give you is that Leslie has already started preparing what the survey is going to look like. And that's our first step, right? Is who's used this variance, and let's hear what they have to say about their process first. And so we're hoping that we can get approval for that to go out next week, and we'll have the survey open to the 55 providers, unless others ask for the variance in between now and then, for a week. So we should be able to, once we have those survey results, really give you next steps as far as engaging stakeholder groups and who those groups will be. But all the people at the table here are on Crystal's radar. Obviously, they've done this before, so. Okay. Do we have other questions, Sherry, or should I go on to the next? Okay. So my next talking point to touch on today is the American Rescue Plan Act Stabilization Grant, so ARPA, as we're all calling it. The ARPA Child Care Stabilization Funding is dispersed in 12 monthly payments, and the payment started in November of 2021, and the payments will end October of 2022. So as of January 9th, which was our last update on all the programs, there were 925 providers who received funding. And so that equates to roughly 77% of eligible programs. We're still doing outreach. Our ultimate target is 100%, but that's where we're at right now. The program is organized to have equal monthly payments throughout the duration of the grant. And we track internally the amount obligated over the 12-month period. I know this is a question that's come up about how will we determine when to close the program. So the program will be closed to new applicants once the funding cap is hit. We haven't hit it yet, but anyone who's already applied and approved is not going to have their payments stopped early. So I just want to provide that reassurance. Of the 925 applicants for stabilization funds, 808 of the programs indicated that they will use funds to compensate staff, and 509 indicated they will use funds for recurring bonuses for staff. Sorry, I'm toggling back to see.
That's really great to hear that high of a percentage has indicated that they'll invest in staff.
Okay, so then I was going to move on to Act 45 and workforce investments. So Act 45 is the act that was enacted from H171. The CDD has been focused on both the early childhood systems analysis, which we talk about in this group, and that effort is being led by Building Bright Futures and Foresight Law, as well as the procurement process for workforce programs. The workforce programs include a new program for loan repayment, as well as a new scholarship program for prospective students interested in entering the early childhood workforce. So just an update on both of those programs. Successful bidders have been chosen for both the loan repayment program as well as a prospective student scholarship program. We are working toward final stages of execution for those agreements, I believe. Also, additional investments have been made to the TEACH program via Act 45, and the amendment to that agreement has already been executed. And then I have an update on the ARPA discretionary funds, sometimes referred to as ARPA supplemental funds. These are like the systems level funding. So the CDD will be increasing the amount of funding to Let's Grow Kids for capacity building efforts, and we'll also be looking to procure additional capacity building agreements. The total spending in this area will be $1.8 million per year. The CDD will also be using ARPA discretionary funding to procure business acumen services for providers, essentially technical assistance and assistance for business practices, and that's $500,000 per year. And then there's an additional $500,000 per year for 2 years that will be added to the base of the $300,000 annually to expand inclusion support funding, previously known as the special accommodation grant. So SAG is now ISF, and that contract is out for bid.
Nicole, can you say, did you say 500,000 added to the 300,000 base? Is that what, or, okay.
Yep, that's what I said.
And can you repeat what that name change is? I'm sorry.
Yep, so the special accommodations grants will now be called inclusion support funding. And I should add that my talking points from today, our communications person is making them look prettier, and we'll be sending them out to our CDD listserv this afternoon. All right. So my next update is on Child Development Division Information System, or CDDIS. So the rollout of the new IT system that we refer to as CDDIS has been temporarily paused. The Child Development Division, along with the Agency of Digital Services, we often refer to them as ADS, are working with the vendor to discuss rescoping some of the aspects of the system that had been de-scoped in order to meet an earlier timeline. So what that means is some of the functionality was taken out of what would be initially launched for the minimum viable product, is what we call it. So the functionality known to many as backdating is being brought back into scope. And how long that will add to our timeline for rollout is still being assessed right now. So the CDD is concurrently exploring the ability to increase rates in our existing IT system, so in BFIS, as our primary goal is to support families and provide and providers during this challenging time with the increased rates that will come with the launch of the new system. So we are exploring how to increase rates in BFIS right now while we're assessing how long this pause will happen on CDDIS. Toggling back. Any questions on that? And I apologize, technology is not my expertise, so I'm going very much on my notes on that one. All right. My last pretty brief update, and then I'm going to hand it over to Leslie, is for STARS and QRIS in Vermont. So we have very recently begun work with federal technical assistance partners to restructure QRIS in Vermont. And when I say recently begun, I mean we've had our first meeting to discuss how we're going to go forward with this. And the CDD will be engaging in planning and execution over the course of the next 18 months with a target date of 7/1/2023 to fully implement changes. Our process is going to involve Vermont stakeholder feedback and consultation from other states. And as soon as I am able to reconnect with federal TA partners, we'll be sharing a planning schedule and key dates with this group. And then if no questions for me, our last update is on Test for Tots. And Leslie Bergeron has really been point person for that. So I'll hand that over. I do see that Janet has her hand up though.
So for STARS, is there, while it's going to get on STARS, are you going to go back to sort of having the level, is anything changing right now in terms of programs for STARS, in terms of being able to, I know there for a while, right, there was the pause on people having to update their STARS. Is that, or is that?
So right now, while we're developing kind of the strategic plan and timeline, we have paused assessments that are not being requested. So the STARS office is not doing assessments right now for programs unless the program is saying, I know I can go up in STARS, I've been working in these arenas and I want an assessment. That's where we're at right now. We haven't changed that. Any other questions before Leslie gives us the updates on tests for tots? Okay. I should have asked. I see you though, Leslie. I know you had to step out. So are you back and ready?
I am back. I'm sorry.
Perfect.
Someone was knocking on my door. So yeah, just a really brief update. We have the Test for Tots program has been launched, and we had 471 providers sign up for the first delivery date, which is today and going on now. I don't have any specific updates about that. I know that there is a meeting with AOT going on right now.
They've heard it's going fabulous, Leslie. We've had feedback from people who've already gotten their test, and they say it's organized wherever they were. I know they're in different locations. I mean, I know they're different locations, but the two people that I heard from this morning were 2 thumbs up.
Good. I'm glad to hear that. Yeah. So then the deadline for the next delivery is tomorrow at noon, and then that delivery will occur on the 20th, the same way this one has. Just very briefly, the program is for children ages 2 to 5 and staff who have been close contacts, and staff would be anybody who is symptomatic or anybody who's unvaccinated. So that's the staff that you would include, and then children ages 2 to 5. And then we are continuing discussions with the Vermont Department of Health and the Agency of Education as information comes up about from CDC and from other the epidemiology folks to keep the program in line with their programs. So it's very brief, but yeah. Tanya?
Yeah.
I don't know if you know, I've tried to get an answer, but the health department and licensing doesn't have an exact answer. So we're going by the letter as it's written within this program. So part of this program requires, with the close contact in the test to stay, that the children wear masks for 10 days. And given the difficulty of young children wearing masks in a not so very sanitary way most of the time, until they're, preschool or better, I have people asking, like, if they have medical exemptions, does that count? And so far we're saying no, because that isn't what it says in the literature. But do you happen to know about that?
Well, we're continuing to talk about masking because we're getting a lot of comments and questions about masking. But what I can say is that you would want to follow masking guidance that you've been following all along, basically. So if someone's medically exempt, then you would follow the protocols that you've been following for those people all through the pandemic. Does that help?
Yeah, it does, because again, we do have certain children that have certain conditions, and they're basically unable to.
Yeah.
And deemed unable to wear a mask, if you will.
Yeah.
So that's good to know. That actually does help a lot. Just for us to know, how we should manage that. So we encourage it, and many of our preschool kids do it, and generally without a whole lot of issue. But we have certain children, and they have certain challenges that mask wearing is very difficult for them, and therefore they may have, you know, a letter from a doctor saying they need to be exempt, right? Or they can be encouraged, but not like they don't wear it, don't worry about it kind of thing. So
Sonia, that is a great question. And thank you, Leslie. That answer makes great sense. To like whatever masking you were doing before, and if they had a medical exemption. There's also the Vermont Health Department is going to offer a webinar on the 20th. And I know they've been meeting with the Child Development Division leader of the program. So hopefully there'll be more information. I know some people are already getting their kits and all of that, and some people have fewer questions than others, right? But that opportunity on the 20th is an opportunity to get more specific answers. And I think what's sometimes hard is that just in our daily life, like some of the answers are changing as we know more, and that feels like really unsettling for people like me who like to plan and have things in a certain way. But hopefully submit questions. We are, Let's Grow Kids will tape that session on the 20th. So even if you can't attend, if you submit your questions, those will be covered in the presentation on that day. So thanks for that.
Oh, I wanted to share a concern that we had heard from some of our regional partners, that there appears to be perhaps a gap for public pre-Ks who are looking for access to kits, that they were in certain situations not don't have access to the K-12 system, and also don't have access to the Test for Tots program. So I don't know if that's come up for at either AOE or CDD, but wanted to just raise it.
I think that may be a misunderstanding. If a pre-K is not school-based, then they would be eligible for the Test for Tots. So I think that.
Yeah, it seems like the school-based pre-K programs were the ones who had been turned down at both doors, at least currently. So if that's not true, that would be great. And we're happy to communicate something out to them.
From every conversation that I've been a part of, if they're school-based, they should be accessing the test to stay program for school. So I can send something to AOE and sort of our contact there and try to.
That'd be great.
I have heard that rumor too. Our district is doing Test to Stay for preschool, but the way it was rolled out is that it's K-12. So if you're looking at the very letter of what was written to schools, it's K-12.
So it started out K-12, but there was another communication that went out increasing that. So that may be where there was a disconnect.
Yeah, I assume that there was a disconnect in whether it was state or regional communication. So something in addition would be great.
And this is Amy. Yeah, we've had those same questions too, Beth, and we've kind of sent our questions up to leadership and asked. So yeah, Leslie, if you have information, sometimes getting that information back down to us from leadership, there's a bit of a gap because there's a lot of information that's being sent out. So yeah, anything that you can tell the early team as well that we can send out, that would be great.
Yeah, maybe we can discuss that this afternoon, Amy. I think you're in the other meeting too.
Yeah, that would be great.
Yeah.
Thanks, Beth, for bringing that up. We're just about ready. We have 1 minute left, and I want to honor your time at this meeting. I want to remind you of the meeting on the 11th of February from 10 to noon as part of the Early Childhood System Analysis Advisory Team. So that'll be our next meeting. If you don't have a link for that, let me know. And Beth, I want to make sure that Alyssa had to pop off, but I want to make sure she gets that link as a new member of the committee. And I also wanted to say, if you have items for March, I jotted down, workforce being a particular perhaps topic of interest based on what we looked at today and some components of that. Maybe a little bit just understanding capacity, but maybe a workforce focus. But if you have different ideas, please send them my way. I also looked at the list of who's included in that Act 35 advisory. It doesn't name people, it names positions, and there really is no, reference. It's a Principals Association, Superintendents Association, it's a Vermont Guidance Counselors Association. So if you look at the list, you do have to wonder how that includes feedback from those working with younger populations. And in closing, I just want to encourage Agency of Education Child Development Division to really, when we think about Vermont AYC, it started with Sonia, being carried forward by Janet, have an incredible outreach component right now to the work they're doing, to the field, networks of, reaching, hundreds and, and in some cases over 2,000 for some of the feedback they've been seeking from Vermont early childhood educators. And I would like to put a plug for using them more in that way. Yeah, I think, and the other thing I just want to mention is Vermont AYC also is the fiscal agent for over 10 of the starting points, what we call now Vermont Early Childhood Network. So they have a lot of reach in terms of how they're connecting with the Vermont early educators. So I hope we start to utilize them that way. And Nicole has one more announcement. Sorry, Nicole.
No, that's okay. I just had one more thing to say. I know I had been asked, and you have all seen, it's been a very quick transition, but Ray Garofano will be taking Mary Beth Redmond's seat in the House to represent Essex. And so I just wanted to let this group know that we do not have answers on kind of long-term planning for that unit, but I know that you probably saw the press release, so I just wanted to address it.
So great for Ray, and my friends that live in Essex are very pumped. So
mine too. I've heard from a lot of people that were like, I was really rooting for her, and she's great. So we're so happy for her.
I'm not happy with the fact she's not going to be working as closely with me for a little while she steps into that, but so sad. And thank you everyone and I'll see you see you in February.
Sounds
good. Yes, Vermont's 50th anniversary launch.
Bye everyone.
Thank you. Bye.
Thanks, Jen.